So the winter comes and then I feel cold all the time. I think people who have arthritis, they probably have joint pain. Do you think?
Yeah, I think it gets worse with the cold climate.
Yes. And arthritis is also another form of inflammation, right?
Right.
So how many kind of arthritis people have? Osteo.
There's a lot of different types.
Yes.
There's rheumatoid arthritis.
Yes.
And there's
osteoarthritis and psoriatic.
psoriatic.
Right? Yes.
There are other types of inflammatory arthritis too. Yeah.
So it's all inflammation. And recently I listened to that functional doctor, Stephen Gundry, and he was talking about how gut lining is related with osteoarthritis. And he said, osteoarthritis is part of the aging, but you can heal that by eating right. And he cited his case study that, there was one guy was scheduled for knee replacement a few months later, and he helped him to change, Dr. Gundry helped him to change the diet and reduce the inflammation. And then after a few months, he came back, he said, I canceled the knee replacement. Yeah, so I think you can get better. Even you have to have the knee replacement if you reduce the inflammation before the surgery and after the surgery, then the result is much better, right?
I think so. It's interesting because there's different measures, right, of arthritis. Like someone can have arthritis and not even know that they have it because their inflammatory levels could be low in that moment.
Yes.
Right, and so they don't feel any pain, but they have bad arthritis,
Yes.
Or there could be people who have just a little bit of arthritis, but they have a lot of pain because their inflammation is very high.
Yes. So you did some research. You always research paper to support what's the other way to reduce inflammation. So you said there is a new research published?
Yeah, there were two very interesting studies published last year in 2025 on frankincense and its use for osteoarthritis. So one study showed that 100 milligrams of frankincense taken daily over 90 days was significantly more effective at reducing symptoms and improving mobility and functional outcomes of patients with mild to moderate knee osteoarthritis.
Yes, that's good. And then the other study, that's 2025.
2025, yeah.
Yeah, it's pretty recent.
There was another study that was even longer. It was done with 300 milligrams of frankincense and I think about... Capsule. Okay. And I think about 200 milligrams of celery seed extract.
Okay.
On osteoarthritis of the knee again. But this was over 180 days. And it showed that it significantly improved mobility and helped with symptoms as well.
Yes.
That first study, they actually did MRIs too to look at the joints, the knees, and they think they saw increase in volume of the cartilage over that 90-day period of people who took frankincense. So it's known to inhibit 5-lipoxygenase, which is one of the inflammatory pathways in the body. But the frankincense may also actually help rebuild the cartilage.
Oh, that's huge. Yeah. Because I watch people, people come to me for over like 10 years, 20 years. So they try different supplement and they try the injection, and especially gel injection is pretty popular, but it really didn't work when they inject. Maybe it worked for a few months and then they go back and then it didn't work anymore. So if combine this
frankincense, yeah, boswellia.
Frankincense, and then, if it can increase the thickness of the cartilage, then that's really, really beneficial. And how do you think the stem cells?
Yeah, I mean, I think the research is very limited in that area now, but there's definitely potential in the future.
Yes.
It's very interesting. There's a lot that we don't know. We need longer studies, with larger populations, but with this new research just coming out last year, I think we'll have much larger studies done now in the future on this.
So how long it takes to take this herb to get a little bit of increases of the cartilage?
Yeah, I mean, we don't know exactly, right? Because it was 90 days.
90 days.
It was done over.
Oh, okay.
So
yes.
Yeah.
If within 90 days something can change, then within a longer period of time, then it might be even better. But I always talk to patients. I said, if you take something for 2 years, 3 years, you didn't see any changes, then I don't think it's working, right?
Yeah, and you have to be careful with your dosing, because
Yes.
I did come across one case report of someone who took like 1,000 milligrams of frankincense a day, and she ended up having severe issues with
What kind of issue?
electrolyte imbalances and had to be
Okay.
hospitalized. But there were other things going on at the same time, so we don't know
Yes.
exactly whether it's the frankincense or other things too.
Yes, and also anything large dosage, like even food, right? If you eat too much, you can cause indigestion.
Yeah.
So you have to start with lowest possible dosage and see how it works for the joint.
Right, exactly.